Health matters now. Tuberculosis remains one of the top 10 causes of deaths worldwide and the leading cause of deaths from a single infectious agent. As the world marks the World Tuberculosis Day with the theme, "The Clock is Ticking," the World Health Organization says collective action across all sectors is needed to ensure and address the challenges and accelerate progress towards ending TB in Nigeria by the year 2030. Kemi Balogun has details.
The National Tuberculosis and Leprosy Control Program says that Nigeria accounts for an estimated 460,000 yearly cases. Only about 27% of Nigeria's estimated tuberculosis cases are detected yearly. The low tuberculosis case detection remains a major challenge in the TB control efforts in the country. Undetected TB cases can become a pool of reservoirs that fuel ongoing transmission of TB within communities, as one undetected case can infect between 12 to 15 people each year. Bitrus Baba lives a few kilometers from Kefi in Nasarawa State. He had spent 7 months out of last year coughing out his lungs before his brother advised him to get help.
I just breathe up like this. Then they come knock my door. They say, "Bitrus, what happened like this? Tomorrow morning we are going to hospital because the cough is too much." So I link finish. Some they say maybe in a HIV. So they started running from me, man.
After his diagnosis, he was put on treatment, and he says just after 2 months on being on the treatment regimen, his body changed.
After I've been in hospital, they have started treating me, give me drugs. After 2 months, I can't see my body starting coming.
One of the 2022 targets is to reach 30 million people with TB preventive treatment so that those people most at risk receive it. But sometimes getting access to treatment can be a challenge for those who need it the most.
The ordinary man in his village who has a cough, who has a fever, does not have a health facility close to him to visit, to access care.
Even after diagnosis, stigma and discrimination can hamper infected persons from seeking help.
People think TB is an ordinary cough, or some would even go deeper to think, oh, it is some attack, spiritual attack, from the community, from my people. So these are myths and misconceptions that have hindered access to TB service. And again, it is stigma and discrimination.
The Nigerian government recently received $890 million from the Global Fund to support the country's fight against HIV and AIDS, malaria and tuberculosis over the next 3 years. Kemi Balogun, TVC News, Abuja.